Most people think bigger shoes are safer for your feet, but what I'm about to tell you might shock you. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After treating thousands of patients with foot problems, I've discovered that wearing shoes that are too big can be just as damaging, if not more dangerous, than wearing shoes that are too small. What's particularly concerning is that many people deliberately buy oversized shoes thinking they're protecting their feet when they're actually creating the perfect conditions for serious foot problems. In today's video, I'm going to reveal exactly how big shoes damage your feet, the 5 most common problems I see from oversized footwear, and how to find the perfect fit that actually protects your feet. You'll learn the warning signs that your shoes are too big, which foot conditions are caused by loose-fitting shoes, and most importantly, how to prevent these problems before they become painful. Before we get started, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others with foot problems find the information they need. I put out a new foot health video every week. The biggest misconception about shoe fitting is that if your shoes don't squeeze your feet, they must be fine. This thinking leads to many people to buy shoes that are significantly larger than their actual foot size, believing that extra room equals extra comfort and safety. This mistake is more common than you'd think because many patients think bigger equals more comfortable. They've been told by well-meaning friends or family members that tight shoes cause problems, so they go to the opposite extreme. What they don't realize is that shoes that are too large create their own set of serious problems. The reality is that your feet need proper support and stability to function correctly. When your shoes are too big, your feet lose that essential support, leading to a cascade of problems that can affect everything from your balance to your spine alignment. How wearing big shoes really affects your feet goes far beyond simple discomfort. When your shoes are too large, several biomechanical problems occur simultaneously, each contributing to potential foot damage and pain. Loss of stability and support is the first major issue. Your feet are designed to work within a stable platform. When your shoes are too big, your feet slide around inside them, losing the stable base they need for proper function. This sliding motion affects every step you take. Foot sliding inside the shoe creates friction and pressure in all the wrong places. Instead of your foot being held securely in a correct position, it moves back and forth and side to side with each step. This constant movement can lead to blisters, calluses, and more serious structural problems over time. Increased risk of falls and balance problems becomes a serious safety concern, especially for older adults. When your feet can't maintain proper contact with your shoes, your balance and stability are compromised. This can lead to trips, falls, and injuries that could have been prevented with properly fitting footwear. Improper biomechanics and gait change occur when your feet can't function normally within oversized shoes. Your body compensates for the lack of stability by changing how you walk, which can lead to problems throughout your lower extremity and spine. Overcompensation leads to stress on muscles and joints throughout your body. When your feet can't provide a stable foundation, your ankles, knees, hips, and back all have to work harder to maintain balance and proper movement patterns. This extra stress can lead to pain and injury in areas far from your feet. The 5 foot problems that can be caused by shoes that are too big represent the most common conditions I see in my practice related to oversized footwear. Understanding these problems help to understand why proper fit is so crucial for foot health. Plantar fasciitis is the first major problem involving heel and arch strain from unstable foot positioning. When your foot slides around in an oversized shoe, the plantar fascia, the thick band of tissue that supports your arch, has to work much harder to maintain stability. This extra stress can lead to inflammation and the characteristic heel pain of plantar fasciitis. The unstable foot positioning in oversized shoes means your plantar fasciitis never gets to rest in its optimal position. Instead, it's constantly being stretched and strained as your foot tries to find stability within the loose shoe. Over time, this chronic stress leads to micro tears and inflammation in the tissue. Achilles tendonitis is the second problem, caused by extra heel movement that irritates the tendon. When your shoes are too big, your heel lifts up and down with each step more than it should. This excessive movement puts abnormal stress on your Achilles tendon, leading to inflammation and pain. The Achilles tendon is designed to handle normal heel movement during walking and running. However, the excessive movement caused by loose-fitting shoes creates stress patterns that the tendon isn't designed to handle, leading to irritation and potential injury. Metatarsalgia is the third problem involving foot pain due to poor weight distribution. When your shoes are too big, your foot doesn't sit in the correct position within the shoe. This misalignment can cause excessive pressure on the ball of your foot, leading to pain and inflammation in the metatarsal area. Poor weight distribution occurs because your foot can't maintain its proper relationship with the shoe structure. The areas designed to bear weight may not align correctly with your foot's pressure points, creating abnormal stress patterns that lead to pain and potential injury. Blisters and calluses are the fourth problem, resulting from friction as your foot slides around inside oversized shoes. While these might seem like minor issues, chronic friction can lead to painful lesions that become infected, especially in people with diabetes or circulation problems. The friction from foot sliding creates hot spots that develop into blisters. When these blisters repeatedly form and heal, they can develop into thick, painful calluses. This cycle of injury and healing can create chronic skin problems that are difficult to resolve. Hammer toes and toe deformities represent the fifth major problem, developing when toes grip excessively to keep shoes on. When your shoes are too big, your toes instinctively try to grip the shoe to prevent it from sliding off. This constant gripping can lead to muscle imbalances and eventual toe deformities. Toes gripping excessively to keep shoes on creates abnormal muscle tension patterns. Over time, this can lead to contractures of the toe muscles and tendons, resulting in hammer toes or other toe deformities that require surgical correction. Why people end up in oversized shoes often stems from a common misconception about foot health and shoe fitting. Understanding these misconceptions can help explain why many people make this mistake. Common misconceptions include the belief that I just need a wide toe box, when what they really need is proper length and width sizing. Many people confuse needing more room in specific areas with needing a larger size overall. Another misconception is, I'm buying them roomy to prevent bunions. While it's true that tight shoes can contribute to bunion formation, oversized shoes don't prevent bunions and actually can create other problems. The key is finding the right fit, not just avoiding tight shoes. How foot size changes over time is something many people don't consider when buying shoes. Swelling, weight changes, pregnancy, and aging all affects foot size and shape. However, the solution isn't necessarily to buy larger shoes, but to reassess your true foot size and find shoes that accommodate your current foot dimensions. Pregnancy, for example, can permanently increase your foot size due to hormonal changes that relax ligaments. Weight gain can cause feet to become wider and longer. Aging can also cause feet to flatten and spread. All these changes require proper measurements and fitting, not just buying bigger shoes. How to tell if your shoes are too big involves several simple steps you can perform at home. These tests help you identify whether your current shoes are contributing to your foot problems. Simple at-home fit tests include the finger behind the heel test, where you should be able to fit about 1 finger's width between your heel and the back of the shoe when standing. If you can fit more than 1 finger, your shoes are likely too big. The slide test while walking involves paying attention to how much your foot moves within the shoe as you walk. Your heel should not lift significantly out of the shoe, and your foot should not slide forward or backward excessively. The toe box check ensures that while you have adequate room for your toes, they're not swimming in excess space. You should have about the width of your index finger of space between your longest toe, but not significantly more. What proper fit should feel like is like having a secure midfoot when the shoe holds your foot comfortably without being tight. Your foot should feel stable and supported, not loose or sliding around. Minimal heel lift means that your heel stays in contact with the back of the shoe during normal walking. Some heel movement is normal, but excessive lifting indicates the shoe is too large. Enough, but too much toe room means that your toes can move freely without being cramped, but they're not sliding around in excess space. The toe box should accommodate your toes comfortably without allowing excessive movement. When bigger shoes make sense, but with caution, include specific medical conditions where slightly larger shoes may be appropriate. However, even in these cases, properly fitting principles still apply. Post-surgery, orthotics, or swelling scenarios may require temporarily larger shoes or shoes with adjustable features. However, The goal should still be to achieve the best possible fit for your current foot condition, not simply to buy the largest shoes possible. How to size shoes appropriately in special cases involves working with healthcare professionals who understand both your medical needs and proper shoe fitting principles. This ensures that you get the accommodation you need without creating new problems. How to choose the right shoe size starts with professional shoe fitting advice that goes beyond simply measuring foot length. Proper fitting considers foot width, arch height, and individual foot characteristics. When and how to measure your feet should be done late in the day when the feet are at their largest due to normal swelling. Both feet should be measured since most people have one foot slightly larger than the other. It's important to note that you should not be firm on a particular size. Every shoe company has their sizing convention, and they often don't match. That's why you should go by fit rather than just by grabbing the size you're used to getting. Shopping tips include trying on shoes with the types of socks you'll normally wear, walking around the store to test comfort and fit, and not assuming your shoe size is the same across all brands and styles. Best shoe brands for common foot conditions may vary depending on your specific needs, but look for companies that offer multiple width options and focus on foot health rather than just fashion. Wide fit options that aren't oversized are available for many manufacturers. These shoes provide extra room when needed without being too large overall. The key is finding shoes that accommodate your foot's specific shape rather than just buying a larger size. When to see a podiatrist becomes important when you're experiencing ongoing foot problems that might be related to poor shoe fit. Professional evaluation can help determine whether your footwear is contributing to your foot problems. Signs your shoe problems need professional help include ongoing pain, instability, or deformity that doesn't improve with better fitting shoes. These symptoms might indicate that structural changes have occurred that require professional treatment. If you found this information helpful, please share this video on social media. Your simple share could help someone avoid serious foot problems by understanding the importance of proper shoe fit. Also, leave a comment below if you have questions about shoe fit or foot problems. I do my best to respond. If you're experiencing foot problems that might be related to poor shoe fit, or you're unsure whether your shoes are the right size, don't wait for problems to get worse. Schedule an appointment for a comprehensive foot evaluation. We can assess your current foot health, evaluate your footwear, and help you find shoes that truly protect and support your feet. The link to schedule is in the description below. Thanks so much for watching, and have a great day.